Hello, everyone. How is my voice? It's good. I usually have to work with like my voice to speak up a little bit louder, which I don't like to do, but I think it will be okay. So first of all, a very warm welcome to everyone. I'm Emilia Kosińska, and I will be the moderator of today's meeting. And this meeting is organized by the Europe region of World Physiotherapy and co-hosted and really made possible to happen thanks to our MEPs, to MEP Kathleen Funchion and to MEP Giorgos. So thank you so much for being here. Thank you for your time. And I hope that this discussion and meeting will really bring interesting points, and maybe it will bring the cancer prevention topic through physical activity forward. So you're very welcome, and let's start with MEP Kathleen Funchion.
Thanks very much. So Accordia Emilia Fáilte, Gudi Parliament in Europa, Don Cruniú Tábhachta Seo. So I want to welcome you all to the European Parliament for this really important meeting. And if I can, I want to offer a particular Emilia Fáilte to our guests from my own native Kilkenny. It's great to have some other Kilkenny people here in the Parliament. So may I begin by paying a particular tribute to the Europe region of World Physiotherapy for their efforts in the area of cancer prevention, and also just to add how important it is for us to recognise the role of physiotherapists in promoting physical activity, prevention and care, not just for those who suffer from cancer, but for those who suffer also from other non-communicable diseases also. So cancer remains one of our greatest public health challenges, as everybody in this room is aware. Each year, millions of people face a cancer diagnosis, enduring significant physical and also emotional burdens, and for their families and loved ones as well. So many lose their lives to this disease, which continues to impact our communities, individual people, of course, and their families. Those who do survive often struggle with reduced independence and can face substantial financial difficulties due to challenges in returning to work or maintaining employment, which can be very, very difficult for people. Prevention is absolutely essential, and that is why we are here today, to bring together cancer researchers, advocates, policy influencers, and physiotherapy professionals from across the EU for a dialogue on shaping the future approaches to cancer prevention. So I very much look forward to the discussion and to all of the contributors. So again, thank you for having us, for bringing us all together, I suppose. So thanks very much.
Thank you so much. And now for MEP Giorgos Georgiou, who is also a member of the MEPs Against Cancer interest group.
First of all, I want to tell you that my wife was recently diagnosed with cancer. So I have many reasons to be here with you. Dear colleagues, dear friends, allow me first to extend my gratitude to the Europe region of World Physiotherapy, as well as to the UcanACT consortium, supporting us to organize this very important event. I would like to welcome the cancer researchers, advocates, policy influencers, and physiotherapy professionals who are here with us today. It is my privilege to be with you, contribute to the discussion, and explore ways of further enhancing our cooperation towards utilizing the viable role of physiotherapy, not only in cancer prevention, but also in supporting people living with and beyond cancer. Cancer remains a major public health problem and an issue of social injustice. While some improvements have been achieved over the past years, much more needs to be done, especially regarding the equal access to information about prevention measures. Our goal is to tackle all inequalities that exist among patients regarding their access to prevention, early diagnosis, medicines, treatments, and patient services. We want to enhance patients' quality of life and safeguard their right to access public hospital and quality care and expertise. Our aim is to integrate patients across Europe, bridging the gap between family groups, professionals, physiotherapists, and policymakers. As already mentioned, cancer prevention, treatment, and care are top priorities for European public health. The Europe's Beating Cancer Plan recognizes the urgency and importance of cancer prevention, treatment, and care as a priority for Europe public health, as cancer diagnoses in Europe are expected to increase by 21% between 2020 and 2040. Without action, cancer-related deaths in the EU could rise by over 24% by 2035. In addition to this, it is expected that Europe to face a shortage of 4.1 million healthcare workers by 2030. This highlights the need for a better integration of not only prevention strategies and cancer care into healthcare systems, but also an innovative integration of impactful healthcare professionals in the cancer field, such as physiotherapists and entities such as public bodies and other organizations for cancer preventive strategies. No one can deny that prevention is a major public health challenge of the 21st century. Modifying key risk factors and implementing evidence-based prevention strategies can prevent between 30% and 50% of cancer deaths. One of the most effective preventive measures identified by global health bodies is regular physical activity. Consistent exercise plays a vital role in reducing cancer risks and improving overall health outcomes. It improves physical and mental health, lowers cancer risk, and improves the quality of life. Therefore, physiotherapy is a core element of comprehensive cancer care, improving quality of life and supporting recovery. My political group, UNGL, the left, has as priority the fight against cancer. We aim to raise public awareness and promote collaboration in the field of research for the dissemination of knowledge surrounding cancer, but also in the development of new diagnostics and therapeutic methods. One of our main demands is to increase EU funding for research and innovation as regards cancer. It is also very important for us to empower individuals and communities with evidence-based, self-managed approaches that can make a meaningful impact across Europe. As a member of the European Parliament, but also as a vice chair of the MEP Intergroup, I would like to reassure you that together with my colleagues, we will do our utmost to ensure the involvement of physiotherapists at the EU's health policy making process. The integration of physiotherapists in community-based programs strengthens the link between clinical expertise and everyday health promotion, making prevention more personal, proactive, and inclusive. The MEPs Against Cancer Interest Group has worked since 2005 to ensure European cooperation brings real added value to national efforts on cancer control and prevention. The MEP focus is clear: to promote health in all policies. This means embedding cancer prevention in all areas of EU decision-making, from the environment to agriculture to occupational safety. We are also committed to ensuring the effective implementation and review of Europe's Beating Cancer Plan and to supporting innovation across prevention, care, and survivorship. We will do our utmost to ensure that physiotherapy as a prevention measure is at the top of the EU health and policy agenda. Research shows that up to 40% of cancers could be prevented through action on no risk factors. Physical inactivity is one of these risk factors. Cancer is not just a medical issue, it's a societal challenge. Health systems must be prepared for future challenges. The expected shortage of 4.0 million healthcare workers by 2030 demands to rethink how we deliver care and prevention sustainably. Prevention must become everyone's business and interest. Our struggle is not easy, but we will continue until health is safeguarded as a public social good for all. Thank you for your attention.
Thank you so much, MEP Giorgos, Georgiou, and also thank you for sharing your personal story with us. So we wish you and your wife all the best in moving forward. So we are moving into the more research-based part of this meeting today. So we have our experts. I'm very happy to welcome Nele Adriaansens from the Europe region of World Physiotherapy Working Cancer Group, who is here with us. We also have Emilia from the Organization for Economic Cooperation and Development. And also we have Alba Gill from the Association of European Cancer Leagues on my right. And last but not least, we also have Karin of International Physical Therapists for Oncology. So thank you so much for joining us, and we will start off with Nele.
Thank you very much. Can we move the slides around, or does it go automatically? Okay. Thank you. Okay, so welcome everyone, and thank you for the organizers and the host for this important event, and also for representing the Europe region of physiotherapy. I think it's very important. So today I want to present to you our role as a physiotherapist in the cancer journey of the patient. And we will focus, of course, on prevention, but of course we have a much bigger role. Thank you. Next slide. So in 2021, of course, we were very happy with the launch of the Europe's Beating Cancer Plan, but we were a little surprised that in the prevention, we couldn't find a lot about physical activity and moreover exercise in this phase. So that's why we took several initiatives with our group, and this is what I want to share with you today. As we know, for several decades, we have shifted from patients need rest, they need to recover, they cannot do something themselves, they need to give control out of hands, to patients really need to fight their cancer their own, and they need to be physically active, literally. Next slide. Because when the body of a patient goes through this cancer journey, they experience many problems with their body. So we need to prepare this body. And it can be compared with when an astronaut makes a space flight. They are real sports athletes when they leave the Earth, but when they come back, when they return to the Earth, they cannot even get out of the space shuttle themselves. So they are very weak. They have an aging process that goes normally over several years, but then it goes in several months. The body is really physiologically aging, and that's the same with our patients. So the fatigue is really a problem. They have less muscle activity. They become in a downward negative spiral because they move less. The muscle mass gets lost, and so they get more fatigued, and that's how they come in a negative spiral. Next slide. So I want to refer in this presentation a few times to the PEC framework, which was developed in 2007, and it means physical activity and the cancer control framework. And you see there are two phases, pre-diagnostic and post-diagnosis. And so you see there is a pre-treatment phase, during the treatment, during survivorship, and even in end of life that is important for physical activity. We will focus on the prevention. As you can see here, in all those phases throughout the journey of the patient, exercise is very important. And in the prevention phase, we know from many research that by being physically active and by doing exercise, that we can prevent cancer. This is very important. And it's for 7 or 8 different types of cancers, so not just one. And it's not only the prevention of cancer, but also from the relapse of cancer afterwards. And there is also prevention of, for example, adverse events, side effects, but also the efficacy of the treatment. And the efficacy of the treatment, of course, when we can improve it, it also leads to less cancer recurrence, but also less cancer mortality and all-cause mortality. So the exercise is very important for the mortality, the survival rates, but also for decreasing the adverse events and to improve the quality of life, which is also, of course, an important aim of the Europe's Beating Cancer Plan. How does this work? I will not go too much into detail, but when a cell develops towers a neoplastic or a cancer cell, there are several mechanisms. And with this physical activity, we can have strategies to stop this development towards a neoplastic cell. And this is in the initiation phase, but also in the promotion phase, and also in the metastatic phase, so for the spreading of the cancer. Another important preventive measure is that with physical activity, we can reduce adiposity. And adiposity is a very important risk factor for developing cancer. So that's also very important. With the prevention of cancer, we can also try with physical activity to restore actually the soldiers in our body, the immune cells that fight the cancer and other invaders, because in people who are not trained, they have constant inflammation, low-grade inflammation, and there is a metabolic disturbance. But when they get active, the army is getting more structured and more strong. So that's what we want to do with the acute effects. They have several pathways to prevent metastasis. And when they are very well trained in a trained body, this army is very well organized to fight these cancers and to prevent from metastases. So what we did with our group was in the first stage, a position paper on the role of physiotherapy in cancer care. And we used the same PEC framework, starting from prevention up until advanced cancer and palliative and end-of-life care. In the prevention phase, what we found in literature in this position paper with the experts, it's also that we can prevent those types of cancers, so 7 to 8 common types of cancer, which of course is very important. But I also want to highlight that the role of the physiotherapist is of course broader than only exercise. What we also did with our group was we made fact sheets, for example, on cancer-related fatigue, which is the most common adverse event of those cancer patients, and also cancer-associated secondary lymphedema, which is also a debilitating side effect of cancer and its treatment. There are also some more recent guidelines in oncology for exercise and physical activity from the American College of Sports Medicine, but also in Europe from the KNGF, which is from the Netherlands. And they are very well, but it's very general, only for cancer survivors, only adults, solid tumors, and hematological cancers. So there are also initiatives for the implementation, and one of them is Moving Through Cancer, but it's from the USA. And actually, they are really doing a great job because they had a plan, a 5-year plan, to implement more physical activity and exercise to prevent, but also to cure these patients. And so in Europe, we are running a little behind, so we need to make extra efforts. So what we also did with our group was a survey to know how is the situation in Europe for the cancer physiotherapy services, but also for education of PT oncologists. So we made an online survey, we spread it through the 37 MOs in Europe, and we had a response rate of 89%, which is actually quite high in this type of research. What we found in the first part of the survey is about service availability. We were very happy with this, that 100% of the MOs provided services to people with cancer. So this is very good, but the majority was through charity. So this is not a sustainable solution. Fortunately, there were also public health, private services, and through research programs. There was only 36% of self-referral to physiotherapy, which could be a lot higher, because it is a barrier for patients to go to the physiotherapist. It can be delivered in group, individual, or through in or outpatient services. What we see in the majority of the patients is, of the MOs, is that we see it during and after the treatment, and only a small part of the services delivered is before diagnosis, so in the preventive phase. So I think we can really take some more action to do something about this. For the reimbursement, about 1/3 can have a reimbursement of all costs of physiotherapy, and another third can claim some of the physiotherapy services, which might also be a barrier. And other barriers might be the knowledge and understanding of the role of physiotherapy in the area of cancer care, but also lack of funding, resources, and demand from people with cancer. There are also some additional barriers, but they are more related to specific MOs and the situation of the healthcare service. The biggest part of the cancer physiotherapy service is exercise, but as I stated previously, of course, our role is much broader than that. When we looked at the second part, this is about cancer PT education, we saw that in 45%, so not only half of the member organizations, oncology was included in the undergraduate training, but in all other cases, it was in a postgraduate training or even not included in physiotherapy training. When we asked the physiotherapists to rate their required skills to treat the patients across their journey in their country, they rated 6.3 out of 10, which can also, of course, be improved. And what we see when we look at the continuous professional development in oncology, we see that there are many more needs than that there are availabilities. So we know that we need more in-service training, for example, also postgraduate modules, and also at the master level, we need to do more for this pathology. What we also know from the special interest groups, we also think this is important that MOs have special interest groups. We had 62% of them who had this special interest group, and only 27% had a register for recognized oncology PTs. So I think we can also increase or improve this. We also had one MO who reported a register only for lymphedema management. So as a conclusion, I think that the PTs are providing care to the patients with cancer throughout the Europe region, and that's something that we're very happy about. But there are vast differences within the region and in some instances within the countries and at the level of the cancer care provided. There appears to be a large resilience on cancer charities and research, so that's not really a sustainable solution. And respondents feel there is a lack of understanding on the role of physiotherapy. So we are really making efforts to increase this understanding and awareness. And as a last point, the PTs require professional development opportunities in cancer care. So in education, there is also a lot of work to do. Thank you very much.
Thank you so much, Nelle. And also for everyone in the room, after the two panels that we have are finished, there will be an opportunity for questions and answers. So if you have any questions to our speakers, keep them safely, and there will be a chance to get back to them later on today. And now to deepen our understanding and maybe to add a few things to Nelle's presentation, I'm happy to Kathleen Funchion from International Physical Therapists for Oncology.
Thank you very much. Thank you for this invitation, and thank you for attending this meeting. I think it's important, but I'm also a physiotherapist. Thank you, Nelle, for explaining what a physiotherapist can do with these patients, but how can we prevent cancer in these patients? So maybe we can have a next slide. Yes, so I'm here as the Vice President of IPT HOPE, which stands for the International Physical Therapy Organization for HIV/AIDS, Oncology, Hospice, and Palliative Care. So these groups are put together, and they were established in 2019 in Geneva during the World Physiotherapy Conference. So we have a world organization for physiotherapy, and the European region is one of the regions, but this group is one of the subgroups. So in this, we find each other. So the European region has its oncology group, and internationally, we have also a group, and we are working more and more together. And I think that's very good because in Europe, we have a high standard of education, of healthcare, and it's also important to spread it all over the world. So what Nele said about the guidelines in the USA, yes, that's true, but I think we have also a lot to bring in Europe, but also for our citizens. So in here, in this picture, you see the countries who are affiliated with the oncology, HIV/AIDS, hospice, and palliative care. And step by step, we are also growing by working together with the European region. So maybe I can have the next slide. Yes, I said in the invitations, there is over 2.78 million new cancer cases in Europe every year. So it's the second cause of death after cardiovascular diseases. And there is also a lot of morbidity, which says a lot of problems when you have had a treatment of cancer. So as said by Giorgos, his wife was recently diagnosed with cancer. I've had also cancer, but I'm here and I'm happy that I'm here. And that's because of the very good healthcare system we have in Europe. But I think to better survive cancer, we can do more with our food, but also with physical activity. So up to 40% of cancers are preventable through healthy lifestyle changes. So we know physical inactivity is a modifiable factor. And there's strong evidence that inactivity has a big influence on the development of breast cancer, colon cancer, endometrial or uterus cancer. And there is more and more evidence also for other cancer, kinds of cancer. Can I have the next slide? So when you move regularly, like walking, cycling, doing sports, it keeps your weight healthy. So extra weight increases the risk of cancer. It reduces harmful hormones like estrogen and insulin, which is, for example, the hormones in breast cancer and uterus cancer is important. It lowers inflammation, so the inflammation can damage cells, so it makes it more stable, and it strengthens your immune system, so to help fight abnormal cells. And you don't have to run marathons, but every day, 30 minutes cycling, walking, or even more can help prevent cancer. But we know that our citizens in Europe more and more are sitting. That's the new disease. Before we said smoking is the origin of cancer, but we see more and more that inactivity is the origin also of cancer. So being physically active lowers also your risk of getting cancer. Can I have the next slide, please? So this is very theoretical. I will not go too deep in it, but there is more and more evidence that being active can prevent cancer. So it can have influence on your hormone regulation, which can prevent different kinds of cancers, inflammation, immune function, body composition. For example, visceral fat has a big influence on the metabolically active and produces hormones and inflammatory molecules, oxidative stress, and also your gut function. So the activity of your gut is very important to prevent colon cancers, but also the microbiota to do the work. So there are more and more, there's more and more evidence that we can prevent cancer by being active. And then I always say, in combination with good food. Because when you don't have good food, it's difficult to move. So it's always a combination. Can I have the next slide? And then more and more we see also rehabilitation in our hospitals. For example, I'm from the Netherlands. it's still not paid by the insurance, so that's a big problem. But to prevent side effects, it's very important to be active before and during the treatment. So to have, for example, a better oxygen delivery during or after the surgery, muscle strength, lower sarcopenia risk, and sarcopenia is having not enough muscle mass, and we know that enough muscle mass lowers the hospital stay, improves the wound healing. So, and again, the immune function, it lowers psychological stress, but also it improves the neurotransmitter balance. So it improves mood and sleep. So we can say prehabilitation is of importance, but also to have healthy citizens. But still, there are 60% who can get cancer, which is not related to lifestyle. But when you're healthy and strong and have a good mood, then your chance to survive and to cope with the morbidity is higher. So I think it's of importance to work together as a European government with also people who are experts in physical activity. Can I have the next slide? So we know of community-based physical activity programs, and I think it's of importance to partner with local governments and health systems, with the general practitioners, but also with the physiotherapists. And what Niele already said, that it's not yet involved often in the physiotherapy education program. So that's also of importance, that we are not only aware of people who are sick, but also healthy people to prevent sickness. And in these community-based physical activity programs, it's important to design inclusive, culturally adaptive activities. So then it's not only for Spain, but you can implement it in different countries. So then it's flexible. And I think it's important to develop that kind of programs. Use safe, accessible public spaces. For example, having good places to bike on the road, to walk to school. So your parents don't have to bring you to school, but you can go by yourself, or maybe your mama or daddy or whoever can bring you a bike. So the infrastructure of our environment is also very important, but also train community leaders and volunteers. So maybe you have a European champion or a world champion or whatever in your environment. Ask them to volunteer, to give lectures about being physical active and how to do it, because young people need others who are an example for them. Social connection in this is very important. Gatherings that they feel together as a group, and they like to come to these groups to be physical active, and you can combine it with digital groups. But I think in face is very important to see each other, to create a community within cities, villages, to be physical active together. May I see the next slides? This is yes. These are some examples, maybe you know. There are more examples, but you can learn from these, and these are really nice programs which have their benefits, but they are still national, in my opinion. I think when we connect this kind of programs and other countries can learn from them, I think that's really important. Can I have the next slide? This is a lot of literature I use, so maybe when you are interested, you can get this lecture. And can I have the last slide, please? So let's keep on moving. Also for us, we all can get cancer or something like that. Be an example for others. And you don't have to be a champion or run marathons or something like that, but take the bike, walk, and stay healthy. Thank you.
thank you so much, Caroline. And as I'm struggling with my throat, so excuse my coughing from time to time. I also will share the presentation that we are sharing today with everyone who is on the registration list. But of course, you can share it further as well. And also, thank you, Caroline, so much for bringing those important points on community-based physical activity programs, because it links so well with the next panel that we will have after the more research-based presentation finishes in a few moments, because this is what the UcanACT project, you can see the roll-up over there. And if you scan the QR code, it will bring you to like the most important information about the about cancer prevention, the cancer statistics, and also UcanACT project and what we did and what happened during this this program. So it really ticks, UcanACT ticks all the boxes that you mentioned. So public spaces, green public spaces, moving in a tailored way that it fits the lifestyle of the person who is actually undertaking the physical activity. And also the community aspect was very important for our participants. And on top of that, we also had physiotherapists who were leading those programs. So this was like the cherry on the cake. So thank you so much again for this. And now we will be moving on to Kathleen Funchion from OECD, from Organization for Economic Cooperation and Development. So we will learn more facts. And also, before I let you speak, also the other Caroline with a different accent, for sharing your personal story. So we are sitting here, 5 people at this table, and we have 2 cancer stories. So the statistics are the real life statistics. Thank you so much.
Thank you very much. It's a pleasure to be there. Thanks for the invitation. So today I will present you some evidence from our OECD publication on cancer and physical activity. Next slide, please. So let me just start with some background information on the European Cancer Inequalities Registry. Next slide. So this European Cancer Inequalities Registry has been developed as part of the Europe's Beating Cancer plan. So it's one of the 10 flagship initiatives, and the objective is to identify trends in cancer burden, cancer prevention, and cancer care in EU countries, plus Norway and Iceland. And it also aims to identify disparities, inequalities across countries, but also within countries by population groups, so by income, by education, by race, ethnicity, when this is possible. So the OECD is part of the collaboration, as well as the Joint Research Center and IARC, the International Agency for Research on Cancer, and it's led by European Commission DG Santé. Next slide, please. So as part of this collaboration, the OECD has published a second cycle of the cancer profiles. So all these publications include first 29 country cancer profiles, so one for each member state, Norway and Iceland. And it's like a country reports on cancer performance in each country. So to produce these reports, we did a lot of consultation with national stakeholders in each country. And this is very important. It helps to get some, contextual information on what's going on in each country. Then we also published a synthesis report to highlight the key findings from the country report. And lastly, we published some cancer performance tracker. So it looked at several domains of cancer performance, so prevention, including physical activity, also cancer care capacity, early detection, and cancer care outcomes. For each country, we do some comparison with the EU average, but we also see progress over time. And also, we want to highlight where things need to be improved in each country. Next slide. So all this work shows that insufficient physical activity is a leading risk factor for cancer, but also to other non-communicable diseases, as you may know. Next slide, please. So in our estimation, we show that over 40% of the cancer burden could be prevented through action on the preventable, modifiable risk factors. So in the left-hand side, you have a presentation of the main cancer risk factors. So as you can see, tobacco is the first one. It explains around a quarter of cancer deaths in EU plus 2 countries, so Norway and Iceland. Then we have alcohol consumption, and then we have the independent but interrelated risk factor, so dietary risk, overweight, obesity, high blood sugar, and physical activities. So physical activity clearly is an important risk factors. Now, in the right-hand side, we can see that there are large variation within countries by population groups, and this is an important key findings. So the social gradient in the prevalence of cancer risk factor is large in all EU countries. So as you can see in the graph, people with low education have consistently a higher prevalence of smoking, higher prevalence of overweight, obesity, higher prevalence of low physical activity. So for low physical activity in particular, you can see that on average in the EU, people with low education are 40% less likely to spend time in physical activity. So the difference is important between social groups, which means that government policymakers need clearly to implement policies that target disadvantaged population. We need to reduce inequalities in physical activity. Next slide, please. Now I want to show you some national data on physical activity. So this graph is taken from the HBSC data. So it's among the young and adolescent population. And it's based on WHO recommendation of spending 60 minutes of physical activity per day among young population. So we can see clearly that on average in the EU, fewer than 1 in 5 adolescents meet the WHO recommendation of 60 minutes of physical activity per day. So this is quite low. So in particular, we can see with the red bar that on average only 22% of 11 years old and 15% of 15 years old reported physical meeting the WHO guidelines of 60 minutes of physical activity per day. We can see that the prevalence of physical activity is the highest in Finland and also in Ireland and Hungary, while it's very low in Italy and France. So there is room to reduce inequalities across countries through best practice, sharing best practice, and this is an important dimension as well. An important finding from the data is that there is a notable gender gap in physical activity. So as you can see, in all countries, boys are more likely to be physically active than girls. So for example, among 15 years old, 20% of boys meet the WHO guidelines compared to only 10% of girls. So we need as well to reduce the gender gap in physical activity. Next slide, please. This is now the data for adult population. It's taken from the European Health Interview Survey. And now, so for adults, the WHO recommendation is to spend at least 150 minutes of physical activity per week, now, not per day. So we can see that only 1/3 of adults meet the recommendation in 2019. So again, this is quite low. Another key result is that the rates varies more than 8-fold across EU countries. So we can see a north-south divide in Europe. So for example, Netherlands, Sweden, Denmark, we can see that more than 50% of the population meets the WHO guidelines compared to Malta, Bulgaria, and Romania, where around 85% of the population does not meet the WHO recommendation. So again, large variation across countries. We should reduce these inequalities. And again, a similar finding that we saw among young population, but the prevalence of sufficient physical activity is consistently higher among men than women. There are some exceptions in Sweden and Denmark where we see a reverse gradient. So on average in the EU, 36% of men meet the WHO recommendation compared to 28% of women. What is interesting to see in this graph is that in Nordic countries where we have a high prevalence of physical activity, these countries tend to show smaller gender gap, while the reverse is true in countries with low prevalence of physical activity. So for example, France, the gender disparity is much larger in this country. Next slide, please. So the OECD team carried out a modeling study to estimate the impact of policies aiming to increase physical activity. So you will show we will show now the many health and economic benefits of increasing physical activity. Next slide, please. So just a quick overview of the evidence in the literature, which show clearly the many benefits for bodies and minds in terms of increasing, for example, sleep, so the sleep quality. It also helps to improve cognitive health, mental health by reducing symptoms of depression and anxiety. For physical health as well, the evidence is quite clear. It helps to maintain a healthy body weight. It helps to have a good balance and coordination, which helps to reduce the likelihood of falls, which is very important for frail and the population, which is aging. It helps to prevent chronic disease, so cardiovascular disease, cancer, diabetes, as we already mentioned during the previous presentation. It improves muscular and cardiorespiratory fitness. And lastly, it improves health, bone health. So what I want to add to all this literature is that the evidence shows that the benefits are true for all population groups, regardless of age, regardless of sex, race, ethnicity. And this is an important dimension if we want to reduce as well inequalities. So given the growing burden of cardiovascular disease, the growing burden of cancer, mental health disorder, the importance of physical activity is very high today. So we need to invest in prevention. Next slide, please. So here I show you the main finding from our simulation model. So in this simulation model, we have the scenario, which is to meet the WHO guideline of spending 150 minutes of physical activity per week among all adults. So if all adults in the EU meet this recommendation, policymakers could prevent over 10,000 premature deaths per year. They could also increase the life expectancy of people who are insufficiently active by 7 months, a bit more 7 months, and increasing average life expectancy for the total population by 2 months. In terms of preventing non-communicable disease, our results show that it could help to avoid more than 11 million of non-communicable disease, including 3.5 million cases of depression, 3.8 million of cardiovascular disease, and 400,000 cases of cancer. So the impact on population health is very clear based on our simulation models. And this has an impact on economy in terms of reduction of healthcare spending. And this is shown in the center of this infographic. So by meeting the WHO guidelines, policymakers could save a total of 8 billion euros per year, which is equivalent to 0.6% of total health expenditure, meeting these WHO guidelines of 150 minutes of physical activity per week. Next slide, please. And now to finish, I want just to show you the economic saving if we meet a higher guidelines of 300 minutes of physical activity per week. I just want to show that we will double, the economic saving. So in total, for the EU 27, meeting the higher guidelines would enable to save a bit more of 32 euros per capita per year. So this is a huge saving, and it only includes the saving for the health spending side. It does not include the indirect saving in terms of impact on labor force participation, because, you know, physical activity by preventing disease will increase productivity and will allow to reduce as well absence from work. So if we combine all the economic impact, direct and indirect impact, the saving will be much higher. Next slide, please. So thanks for your attention. So I invite all of you to look at our publication, which provide all the estimations that I just presented. So the profile, obviously, but also Health at a Glance Europe. So you will have all the data on physical activity per country. And lastly, the Step Up publication, which is about the simulation models that we carried out at the OECD. Thanks a lot.
Thank you so much, Kathleen, for presenting the sobering numbers to all of us. When we see billions, which are just less than 1% of total spending, it gives you a perspective as well in terms of what looking after our own health can do to the economy as well. And we live in a world where money make it go around. So maybe this will be a good a good tip to our policymakers to invest in physical activity in the communities as well. This session will be finished off with Alba Gil, who represents the Association of European Cancer Leagues. So we will hear more about the flagship EU project that MEP Giorgos mentioned at the beginning, which is the Cancer Beating Plan, and more details on all the things that we all should know in terms of cancer prevention, but also health equity. Thank you so much.
Thank you, Emilia, and thank you very much to the World Physiotherapy European region for organizing and for bringing us together. Thank you to my co-panelists. I think we are seeing together how the pieces of the puzzle fall together, and hopefully I can add the policy and equity perspective that has already been indicated. So at ECL, we are the voice of national and regional cancer leagues in Europe, and we represent them at European level. And we work through the whole continuum of cancer cycle, which is this from prevention, early detection, diagnosis, treatment, and survivorship. And we have already heard how physical activity, and most important, physical activity together with healthy diets and normal weight is the perfect match. And it's the perfect match when it comes to prevention, and it's the perfect match when it comes also to diagnose. We heard from Nele how it increases the level of survivorship, and how it increases also the efficiency of the treatment. Just to give you a number, it's 20% less of risk cancer that we can have if we are physically active, if we are in a normal body weight, and also if we eat healthy. In specific cancer, this means less risk of colorectal cancer for men, and less risk for breast cancer for women, which is the most common cancer for us. And if we look at survivorship, and also bringing the data that from a paper that came out last week, actually looking at colon cancer, we see that after 3 years of recurrent physical activity after chemo for colon cancer patients, survivors, the risk of recurrence was 30% of any cancer, but the risk they reduced 30%, and also the death for all causes, not only cancer, because of course there are full of comorbidities because of the astronaut body that we heard, it decreases almost 40%. So in a nutshell, physical activity, it's a health insurance. And it also inhibits risk factors, and we have evidence pointing out that, of course, it helps you to not to be overweight and to maintain a healthy body weight, which is massively useful, of course. It helps you to eat healthier because you feel like eating more fruits, more veggies, more pulses, and it stops it can help to contrast the certainly the risk of having sedentary behaviors. I will not ask you which kind of job you have, but if you are as lucky as we are,
This kind of
yeah, this kind of job, indeed. And we know that spending more than 8 hours a day sitting down increases the risk of cancer. And just to give you a glimpse, when we talk about cancer and weight, we know that overweight and obesity increases the risk for 13 kind of cancers, which include breast cancer, which is the most common for us, for women, and also colorectal cancer, which is the third most common cancer for both women and men. And just not to leave out the men in the room, if you were wondering which is the most common cancer for you, it's lung cancer. And we heard also is the most deadly cancer. Around 20-25% of all deaths for cancer are due to lung cancer. It's not a secret that tobacco is the #1 risk factor. But also colorectal cancer is the second most deadly with 10% of all deaths. It's linked to weight and obesity. The third, liver, is also linked. The fourth, breast, is also linked. The fifth, stomach, is also linked. So at the end of the day, we have that 4 out of 5, the most deadly cancer, are linked to weight and obesity. So I think the numbers speak quite on their own. But what are we talking about when we talk about physical activity and cancer? And here we have already mentioned the golden rule is the more the better for physical activity. And of course, we are not talking about doing burpees all day, but to have as much light activity as possible, to take the stairs instead of the elevator, to walk to work, to come by bike to work. In Brussels, that's quite possible. But also in combination with moderate physical activity and vigorous physical activity. And we have already heard the minimum numbers. But if we look at the week numbers, this is 20 minutes a day. And here, a break in the presentation. Please don't let the perfection be an enemy of the good. If you cannot 20 minutes a day, it's okay. 10, 15, 5, just these small choices like an elevator, the stairs. Not in the European Parliament, because then you can get to very strange floors. So don't do that here. But if you know where the stairs head, please take the stairs. And for moderate intensity, what do we mean? We mean brisk walking, we mean dancing, we mean tennis. Of course, for vigorous, is when we cannot talk and walk at the same time. But again, if you don't have time to go jogging, that's okay. Leave the metro, the bus a couple of stops before and walk the rest of the way. Because the more we move, the more we increase our protection ourselves against cancer. So what are we doing at European level to reduce our cancer risk? And here we are going to look at two tools. We are going to look at the policy tool, which is the Europe Beating Cancer Plan, and we are going to look at the individual behavior tool, which is the Europe Code Against Cancer. So if we look at the European Beating Cancer Plan, and this has already been mentioned, this is the largest initiative that has been ever put forward at European level, the most ambitious. It was presented in 2021, and it was funded with 4 billion euros. And the idea was simple. Cancer is actually the leading cause of death for population under 65. And in some countries, as Belgium, as Spain, as the Netherlands, it's already the absolute first killer. So let's tackle that. And also we have the numbers that, thank God, mortality is decreasing, but recurrence is growing, which means that every time we have more survivors, and we have already heard the problems that this can return to work, access to financial services. It's not only when you go or when you are successful in beating your cancer, it's the life after cancer. And I think everyone is touched by this. I don't know anyone, and please, if you are one of these, raise your hand. It has not been touched by cancer directly or indirectly. So at the end, we are talking about one of the major issues at European level. So the European Beating Cancer Plan And again, talking about the perfect marriage between physical activity and healthy eating, put together the flagship initiative for healthy lives for all. And this was done, it's a campaign launched between 2021 and 2023. I think it was not collaborative. At European level, and basically the idea was that together with the member states, regional and local authorities, governments, civil society, to promote healthy choices, to become the healthy and the easiest and the most affordable choice for all. So to normalize physical activity, and this was done with the member states. And it also included another initiatives because physical activity is not only physical activity. It was also at schools, at education. It was also at parks. So many initiatives were put together as the European Week for Sports, the EU School Scheme, Erasmus program, the European Mobility Week, and the promotion for agri-food products. When it finished in 2023, the European Commission did a study on how it went, and the idea was great, and it could have been beautiful, but it fell short. It fell short in accessing and reaching out to specific stakeholders, to vulnerable groups, and we have heard that this is, and we will hear more that this is the critical population. There was also lack of visibility and political recognition of the importance of lifestyle, so it's a bit dismissed underwords, and also the lack of financial and human resources. And you can be creative, and governments are very creative in putting forward a lot of activities without budget, but creativity has its limits, and at the end of the day, we need money on the table. And also together with the Europe's Fitting Cancer Plan and looking at the other partner of the marriage, the healthy diets, we still have the key initiatives missing, either missing, not published, lost in the European Commission, or not implemented. And here we have the proposal for mandatory front-of-pack nutritional labeling, the Nutri-Score, for sure you have heard about it, but also healthy food marketing for children, the EU Action Plan on childhood obesity review, to see what happened and how we can improve mandatory labeling for alcohol and health warnings. And here I wanted to throw some hope, because the European Commission is not doing the homework, but the member states are starting to do the homework. And we see a lot of national initiatives actually looking at these policies. You all know Nutri-Score, you all know the traffic light system. Norway, in a few months ago, they passed the healthy food marketing for kids legislation. Denmark is supposed to do the same before the end of the year. And Ireland has done massive improvements, and we hope it's implemented and not hampered by industry, alcohol industry, on introducing health warnings in the alcohol, in the alcohol. As we have now, now you take a package of tobacco and it says tobacco causes cancer. But in Ireland, there will be the same when you take a beer and when you take a drink, alcohol causes cancer. Because there is no other way to put it, people, alcohol causes cancer. And alcohol is one of the main risk factors for breast cancer, which again is the most common for us, for women. And moderation, it's a lie, just for you to know. Moderation is the parents at Christmas. Doesn't matter, you don't need to be a heavy drinker to increase your risk of cancer. And at individual level, what do we have? We have the European Code Against Cancer. This is 12 recommendations that was already mentioned. IARC, the International Agency for Research on Cancer. I have more copies, so don't hesitate and ask me. And these are recommendations that, with the WHO, they are giving at individual level. What you, as individual, not systemic, can do to reduce not only your risk of cancer, but the risk of cancer of the people around you. And of course, physical activity. It's part of this recommendation, together with healthy diets, together with normal weight, and together with not to smoke, which is the golden rule when it comes to cancer prevention. And the guidelines are the same. It's the WHO guideline. We have heard about them. Light activity, the more the better, and some moderate and vigorous activity during the week. And indeed, we have already all seen the data, but at the end of the day, almost 70% of Europeans, we don't move. We don't reach the minimum. We don't reach the 20 minutes a day of physical activity. And this is not an individual behavior problem. This is a systematic problem. And now we will see, for example, that when we look at countries, and this has been already been shown, we have always the same countries coming back. We have Romania, we have Cyprus, we have Bulgaria, we have Greece, we have Poland, we have Hungary. And if we look at the other part of the perfect marriage, we see that overweight, again, we have the prevalence of the weight 2022, the same countries, Romania, Bulgaria, Greece, Cyprus. But if we look at consumption, 5 portions of fruits and vegetables together, yeah, the average of the European Union does not get to 15% of population that it is, 15% of population. And this is the other part of the marriage between physical activity and healthy diets. And again, we see the same countries, Romania, Cyprus, Bulgaria, Greece, Poland. And then when we look at, and thank you, Caroline, and also thank you for the work you do and the data you provide, because at the end, without data, problems don't exist. So we need to look at disparities, and we need to look at what is happening within the member states. And when we see that the screening program, so the early detection, because early detection is key when we want to tackle cancer. It's not the same to spot a cancer in stage 1 and stage 4. The probability of mortality absolutely changes. For breast cancer, again, the most common for ladies, we have that almost more than 80% of the population in Denmark is screened, and for Slovakia, it's not even 30%. For colorectal cancer, the third most common and directly linked to physical activity and also to diets. Finland, almost 80%. Hungary, not even 10. And just to finish giving the whole picture, what we have is that these countries and these populations that are the ones with more rate of obesity, with less rate of fruits and vegetables, are also the ones with higher risk of poverty and social exclusion. In the European Union, in 2024, more than 20% of populations are under the risk of poverty. And this, for Bulgaria, it's more than 30% of the population. This highlights the massive gap that we have within the union and the massive gap that we have when we put forward policies and where they reach and how well they reach. And indeed, this is from the report that I can only recommend. It's wonderful, and it's also by country, so it can give you a good overview of your own member states. At the end of the day, if we look at all the data and we put it in the big picture, the #1 risk factor for cancer is poverty, and it's low education and it's social exclusion. And at the end, what we do is this part of the population, they are more exposed to the main risk factors, to tobacco, to unhealthy diets. They have less access to green spaces to do physical activity. They have less time. Probably they have physical jobs and they are tired at the end of the day, but they also have less access to screening programs when the cancer is starting to be visible, and less access to treatment, and less access to medicines. And also, when they return to work or stay at work, it's way more difficult, and they have way less social protection, actually, than higher socioeconomic populations. And the risk factors, they are the same: tobacco, alcohol, air pollution, overweight. And these risk factors have already been pointed out by the WHO. They are called the commercial determinants of health. So these are the commercial practice that have an influence in health. It doesn't need to be negative, but usually they are. And these four industries are accountable for the 20%, 25%, 1/4 of all death globally. So having all this picture, we see that inequalities in access to physical activity just mirror the systemic inequities that we see through all the cancer continuum and through all the parts of the population. And we see that political inaction perpetuates the problem. If we don't do anything, if policymakers don't do anything, this is not going to change. Because we see the increasing rates of inequality, they are just growing. So political inaction is not inaction, it's the perpetuation of inequity and poverty. The social contract must be restored. The European Commission is the guardian of the treaties. And these treaties that ensure that the population will have a high level of protection of human health. And this must be restored. The European Parliament, now we are in the largest transnational parliament in democracy. The Euro-Speaking Cancer Plan has not been fully implemented. And still the European Parliament is talking about the harmful consumption of alcohol, as if there was a non-harmful consumption of alcohol. And last, public health interest must be the priority. Health in our policies cannot be just a beautiful slogan that we keep on repeating. It must be a reality, because at the end of the day, we are condemning vulnerable populations into the poverty and to the poverty trap, and we are not building a union. We are building a segregation of countries. And cancer is just another expression of this. Thank you very much.
Thank you so much, Alba. This was great to hear. You brought this really perfect review of everything that has been talked about earlier today, and gave also really good practical tips on the physical activity during our daily lives. It's just really a matter of not sitting as we are right now, but also for for bringing up the realities of policy life cycles, because all of this sounds great on paper, but then we go into the real world and it turns out that the world is not that great. But hopefully we can change the world together. But it does take a lot of work. Like every single thing takes a lot of work, and unfortunately a lot of money and resources. Also what you mentioned earlier, human resources. One person can't do it all, or 10 people can't do it all either. We need a lot of help and support. And also thank you for bringing the issue of lack of equity in the European population. We're probably most of us here are quite privileged, so let's not forget that there is the other side of the community. Okay, so my voice is going, but we will do a little shuffle, because our also women-only panel, it doesn't happen often actually at these events. So as our fantastic speakers are leaving the stage, we will have a swap with our UcanACT consortium. So I will ask Fran, Devin, Michaela, Janet, and Catherine to take your seats with our flagship project, UcanACT, for the Europe region of World Physiotherapy. This is really the kind of a sad meeting, because this is the end of this project, or maybe it's a good thing that it's the end of this project. We created the Europe region of World Physiotherapy, created this consortium that you will learn about more in a moment. And it's really about physical activity for people over the 50 years of age in public urban green spaces, and on top of all of it, we added physiotherapists as the leaders of those physical activity sessions that we provided in 3 different territories that our partners will tell you more about in a moment. So without further ado, let's welcome the UcanACT consortium. We have Devin Bayer from Outdoors Against Cancer from Munich. We have Michele Canone from that's the thing. When you work with people, you never know their affiliations. I have them all written
Italian
down.
Physiotherapy
Exactly.
Association.
Of the Italian Physiotherapy Association. And we operate with acronyms so often, but the acronyms will tell you nothing. We have Franz Theron of the Irish Society of Chartered Physiotherapists, and Janet Boren and Catherine Peacock from the Kilkenny County Council, which I believe is quite close to the heart of our co-host MEP Kathleen Funchion. So later on, we will welcome the other members of the consortium, so I will introduce them then, and we can start off with Fran. Thank you so much.
Thank you. Good afternoon, everyone. On behalf of the project partners, thank you for the opportunity to present our very successful UcanACT project. And thank you to the Europe Region of World Physiotherapy for inviting us to be partners on the project. The UcanACT project, or Urban Action Against Cancer, the objective was to engage citizens over the age of 50 to participate in physiotherapist-led physical activity for primary, secondary, and tertiary cancer prevention in public urban green spaces, referred to as PUGs, green spaces, or parks. The project, thank you, I was going to say next slide. The project is a transnational intersectorial initiative bringing together 8 partners from nonprofit organizations, local councils, universities, physiotherapy associations across 5 countries in Europe, together with the associate partners and with multiple stakeholder engagement. Next slide, please. The project was delivered through a work plan and a series of work packages. The initial desk-based research by various partners looked at the evidence of physical activity for primary, secondary, and tertiary cancer prevention and the side effects of cancer treatment, as well as looking at the benefits of engaging citizens in physical activity outdoors and the motivators and barriers to the engagement. This led to the program methodology and tools, with the development of a practical intervention methodology, the PIM, or the handbook, which provides guidelines and recommendations for physiotherapists for the implementation, and the development of the massive open online course called the MEP, which is available free for all physiotherapists and healthcare practitioners, which was the development of the PIM, the handbook, into the online course. We also developed an app which provided the support for carers, citizens, and family members to continue with the physical activity, as well as the citizen engagement strategy, which encouraged the target group to participate in the activity and the evaluation methodology. So all of this work culminated in the implementation of the physiotherapist-led physical activities within the 3 pilot territories: Kilkenny in Ireland, Bologna in Italy, and Munich in Germany, with 2 rounds of physical activity. The initial round was within the first quarter of 2024, where citizens engaged in physiotherapist-led physical activity with 60-minute sessions once or twice a week for a series of 10 weeks, providing community-based program. The lessons learned from the first pilot were considered for modification and implementation for the rollout of the second pilot, which occurred in the last quarter of 2024, with many citizens continuing from pilot 1 into pilot 2. And this continued across the 3 pilot territories. So the physical activity intervention included a warm-up and a series of exercises, which included aerobic, flexibility, balance, and strengthening, as well as a cool down. And the exercise sessions were progressed as the citizens progressed from their baseline on a weekly basis. It's important to note that prior to engaging in the physical activity, all participants were medically cleared, and using the IPAC short form were stratified into one of 3 groups according to their baseline activity level, either inactive, moderately active, or health-enhancing physical activity, so all citizens engaged in a physical activity level appropriate to them. The physiotherapists attended an in-person training day, and community managers attended information sessions. Further details on elements of this will be shared by my colleagues by the pilot territories, the results of the intervention, and the economic value and the cost effectiveness. So why was this topic chosen? And I guess we've already had our previous panel. It's no real, it's an obvious kind of answer to that. The previous panelists have presented extensive statistics on the prevalence of cancer. Cancer is the second leading cause of death in Europe. And every minute, 5 people in the EU are diagnosed with cancer. Sorry, next slide, please. Thank you. So the project aligns with the priority of the European Commission and Europe's plan to beat cancer. Up to 40% of cancers could be prevented by modifying or avoiding key risk factors and implementing evidence-based prevention strategies, such as engaging in physical activity. Encouraging participation in sports and physical activity as a tool for health aligns with the Erasmus Plus program horizontal priority. However, as already mentioned by our previous panelists, nearly a half of Europeans never exercise or play sport, with illness one of the main reasons not to engage in physical activity. And our citizens do not meet the recommended requirements of physical activity. The project also aligns with the European Green Deal and Sustainable Development Goals. The WHO defines sustainable healthcare as a framework that aims to improve, maintain, or restore health while minimizing adverse environmental impacts and tackling opportunities to improve the well-being of current and future generations. Member states committed to turning the EU into the first climate-neutral continent by 2050. The project aligns with the 2030 Agenda on Sustainable Development by either aligning directly or indirectly with Sustainable Goal 3, Global Health and Wellbeing, Sustainable Goal 11, Sustainable Cities and Communities, and Sustainable Goal 13, Climate Action. Physiotherapist-led physical activity sessions is an important contributor to sustainable practice. Engaging in physical activity in green urban spaces contributes to the delivery of sustainable practice through prevention, promotion, lean service delivery, and offers a low-carbon alternative. Engaging in physical activity aligns with environmentally sustainable practice and promotes sustainable healthcare through, next slide please, prevention, promoting health, preventing disease, and tackling the cause of illness, healthcare that is never needed. Promotion, empowering our citizens to take a greater role in managing their own health and healthcare. Physiotherapists educate patients to manage their own health conditions. Offering a lean service delivery method, streamlining our care systems, and minimizing wasteful activities. Physiotherapist involvement in early intervention results in a reduced overall healthcare consumption. And offering a low-carbon alternative, prioritizing treatment with a lower environmental impact to reduce the healthcare carbon footprint. Physiotherapist interventions are a low-carbon alternative, which supports sustainability. Physiotherapists have an opportunity to make a significant difference in the management of patients with cancers, other non-communicable diseases, as well as mental health, and in the role of prevention and promotion, making a difference to citizens' quality of life, and provides an opportunity to rethink how we deliver care and reduce the inequalities of physical activity. Thank you for this opportunity, and I'll now hand over to our partners. If I can introduce Devon from Outdoors Against Cancer, he will be followed by our other pilot territories. Thank you.
First time. By the way, very comfortable chairs here, I have to say. So thank you, Fran, for the overview on our theoretical framework. There was a lot to be done before we could start with a practical application with our pilot territories. I speak on behalf of Outdoors Against Cancer from Munich. And yeah, we heard about the theoretical framework, but let's dive a little bit into specifics and what actually happened. So next slide, please. And thank you to the ghost who switches the slide, by the way, also at this occasion. So we had, we have some abbreviations. Don't get confused by them. We'll try to not use them as much. We had to use them a lot during the project. PUGS means actually public urban green spaces. CPPA sessions are cancer preventive physical activity sessions. So, but we try to use the normal terms like training sessions and parks. But please don't be mad if these abbreviations sometimes slip out. So we actually had 5 parks in which we offered these training sessions. This doesn't mean we had closed groups in these parks. So some participants actually participated in many locations or a few more locations than just one. In total, we had 29 sessions. All the pilot territories actually exceeded the amounts given in the proposal. The other pilot territories even more so. They did an amazing job, by the way, I have to say. So, but they will tell you about it later on as well. We had 61 participants in total, and we had 15 physiotherapists in total as well. Not just physiotherapists, the proposal also included general exercise specialists, like, for example, sports scientists like myself. I also attended most of the training sessions, and other exercise professionals. Next slide, please. Thank you. So we have a small map of Munich where we can see locations of the parks that we used. We had the Hirschgarten in the west, the Isar Park right central, the Isar Kandelplatz. It's actually a calisthenics park right in the south. And this is kind of a full closure or loop moment because our NGO, Outdoor Against Cancer, was founded 2015 with outdoor trainings in that specific park. Yeah, our founder, Petra Thaler, had cancer herself and started these trainings, and it's kind of a full circle moment. And we also, after the end of the UcanACT project, resumed with outdoor trainings starting since April, free of charge every Wednesday in that specific park as well. Not yet, too fast. Yeah, and we had the other 2 parks, the Kustermann Park and the Postwiese. And at this point, because it fits quite well with what Alba is also saying with the healthy lifestyle for all, since 2015, I don't want to say we were pioneering, but we were quite early on with the holistic approach, I think, because the philosophy of Outdoor Against Cancer is built on 4 pillars, namely physical activity and outdoor sports, balanced nutrition, environment and nature, and mental and physical well-being. So I think it kind of fits well into that track. Next slide, please. Thank you. At this point, I also want to mention some stakeholders and organizations that helped us to make this thing as successful as it was. We have 2 sports clubs, the ESV München, which is one club in the west of Munich, and the TSV München Ost, my football club I play since 20 years, that helped us with recruitment, where they could use their facilities for flyers and posters and their newsletters, as well as the municipality of Munich and the Freizeitsport, which is an organization from the municipality of Munich that actually also offers a lot of outdoor sports activities free of charge. Also, the LMU, the Ludwig Maximilians University of Munich, helped us with the application of the ethics committee process, because there was a lot of stuff that we had to do until we were able actually to get to the training sessions. Next slide, please. Yeah, you can read these testimonials for yourself, but we will get a little glimpse of our storytelling videos that every pilot territory produced. Just a little snippet though. There's a longer version you can find on YouTube on our UcanACT channels. Please look at them because I think they're lovely from all the pilot territories, and tell a little bit more about the story and how the project actually went. And finally, we can go to the next slide. Thank you all, and thank all the partners. Also thank the previous speakers. It was really, really interesting. Also the MEPs. It was so far a really, really interesting event. And I want to come back to something you said, Alba. Everything worth doing is even worth doing a little. It's like brushing our teeth. It's the same with movement. It's the same with exercise. So never be the perfectionist and just do stuff, even if it's just a little. That's my little final message. And with that, I will give over and hand over to my colleague, Michele. Thank you.
Thank you, Devin. I represent the work that has been done in Bologna municipality, in Bologna territory, and I will try to give you the feeling of the challenges that we had, and also a view to the futures of projects like UcanACT. Next slide, please. Bologna is a territory very advanced in terms of services for the citizens. So projects like UcanACT have been in place also by the municipality and other stakeholders and other organizations. So also citizens are very used to respond to this kind of initiative. So for us as Italian Physiotherapy Association and UcanACT Consortium, we had a challenge to be part of these big pictures and to be recognized among the stakeholders as an impactful organization and project. And we decided to accept the challenges by showing numbers, quality of services, impeccable organization and communication, and also by truly impacting the life of our participants, of our citizens. And of course, to try to give also futures to this kind of initiative. Next slide, please. As you can see, numbers in Bologna are quite important. Like we had 88 participants with a wonderful team, task force of physiotherapists of 15. We recruited 4 public urban green spaces in the city, trying to be representative on the geography of the municipality to get people from all the neighborhood get easier access to the sessions. And we went far away from the just 18 sessions provided by the project. We went through 65 sessions for our citizens. Next slide, please. This is, I wanted to show as a thankful also the task force of physios, because we had 15 wonderful colleagues coordinating by Dr. Sanna Foggetti, who she is here, and I want to thank her personally for the support for the project. That you were great. And among the physiotherapists, we had senior and junior physiotherapists willing to improve. Some of them were already expert in the oncological field. And everybody together, we learn a lot from our tools for the project, like the practical intervention methodology and the citizen engagement strategies. We did a lot of focus group together, and we kept the communication with our citizens continuous through WhatsApp group. The results, in a narrative way, because we have data that will be shown later, were amazing. We were such a game changer for many of our participants. We know, because we are in touch with them, that now they moved from an inactive life to be part of yoga classes, gyms, and they keep moving in the parks that we recruited alone. And we are waiting for us. We're waiting for us for know what is the futures of the project and what do we need for the futures of the project. We need stakeholders. Next slide, please. Next. Yeah, we need stakeholders. In this slide, I show you the European stakeholders on one side and the local stakeholders on the other side. They are patients' organization, professional organization, municipality, politician organization. We need people to get together to do what we can do, as small as we can, but is part of the big pictures. And the future plan is that citizens will establish a private contract with our physios to keep going, but we want not to touch the pocket of the citizens. So with the Order of Physiotherapists of Bologna, we are trying to find a way with the municipality to help people also to get fit without spending too much money. And also we are going outside Bologna, because other territories, like for example, Region Campania in Italy, they invited us to show the project and to understand how the project, the template of the project could be exported in a way. So we are looking for follow-up project to keep impacting in this direction, not only in cancer, but in all non-communicable disease, because we could impact in a broader way. And I think that's it. Next slide for today. I want to thank you, everybody, for being here. And I hope that the dialogue after will be engaging.
Thank you so much, Devin and Michele. And we will move on to the last of our trio, as we joked yesterday, that it's a trio of pilot territories. So last but not least, Kilkenny in Ireland, and we will have Janet and Catherine to tell you more about how it went over there.
Thank you, Emilia. So Kilkenny County Council and the Irish Society of Chartered Physiotherapists represent the Irish partners for the UcanACT project in Kilkenny. I'm going to focus on the stakeholder engagement for the project. And my colleague Catherine is going to talk about citizen engagement strategies implemented in Ireland. Next slide, please. Okay, so the specific role of Kilkenny County Council in this project was the development and implementation of a citizen engagement strategy for the programme in Kilkenny. We were responsible for the stakeholder engagement, recruitment of the participants. We organised the screening clinics and focus groups for the participants. We organised training and information sessions for the physios and the community managers involved. We organised the pilot rounds and supported the participants and the stakeholders involved throughout the project. And lastly, we assisted with the data collection and the evaluation process with our academic partners. Next slide, please. So, with relevance to the stakeholder engagement piece in Ireland, we mapped the stakeholders at the very early stages of the project. So we wanted to know at an early stage who needed to be involved and what their specific role was. These stakeholders included physiotherapists, gatekeepers for recruitment, and community managers. We provided these stakeholders with information about the project to raise understanding and gain commitment. The Irish Society of Chartered Physiotherapists engaged public physiotherapists from New Park Primary Care Centre in our health service executive. We had private physios from Kilkenny Physiotherapy, and we also had student physiotherapists from the University of Limerick, which formed part of their clinical placement. Dr. Emer Guinan processed ethics for Ireland through Trinity College Dublin and supported the screening clinics, training for the physiotherapists, and the pilot rounds. The physiotherapists were responsible for the screening, setting the exercise level, and implementation of the programmes. Kilkenny County Council, in collaboration with our community managers, worked together to recruit participants and seek advice for the engagement strategies with the participants. The participants were recruited through the following agencies. So Cushnor, which is based in Kilkenny, is our local cancer support service. They directly engage with their clients in the project via WhatsApp and email and their social media channels. The Nordragon Paddlers are a local cancer survivorship paddlers group. They promoted the project and the recruitment drive via their WhatsApp channels, email and social media. The Health Service Executive promoted the project, displaying posters in our local hospital, the Chronic Disease Hub and the primary care centres in Kilkenny City. Kilkenny County Council directly recruited participants through the Kilkenny Older Persons Council and our local Healthy Ireland network. Older persons groups were targeted through our family resource centres. We attended their group meetings to provide information on the project and directly recruit from those groups. Our local sports partnership also helped promote the project within their own network. Lastly, we advertised the project in our local newspaper and on Kilkenny County Council's social media channels. Out of all these gatekeepers for recruitment, Cushnor were the most successful recruiter for people living with cancer or in survivorship of cancer. And our local newspaper was the most successful recruitment pathway for those living without cancer. Together, all these stakeholders played a crucial role for recruiting participants, our citizen engagement, and offering expert advice along the way. And now I'm going to hand you over to my colleague Catherine, who will talk about the engagement with our participants.
Slide across there. Yeah, our citizen engagement approach was very nurturing in Kilkenny, and that was, I suppose, shaped by the guiding principles of the community engagement strategy that we developed. So they were creating a safe and trusting environment to enable citizen input, ensuring early citizen engagement and shared decision-making, and investment in citizens who felt that they lacked the skills or the confidence to engage with us. So with that in mind, as soon as the participants were recruited, a series of focus groups were held in local hotels. And that was an opportunity to introduce the project to the participants with a real focus on identifying what the participants' aspirations, their needs, and their expectations of the project were. And for us to understand any barriers to their participation and to measure the digital awareness among the participants that we could feed back then to the developers of the UcanACT app. This was also a great opportunity for us to select the most relevant urban green spaces. Initially, participants were very reluctant to actually participate in public. However, by the end of this project, they'd grown so much in confidence that was actually turned on its head, and they really enjoyed the interest from the general public. The green spaces were then chosen based on the feedback of the participants, and this is highlighted in our needs analysis. And these included the availability of seating, shelter from inclement weather, elements of privacy, adequate parking facilities, toilet facilities, and even surfaces underfoot. The green spaces were then risk assessed, ensuring suitability and the safety for the participants and the types of activity and the profile of the participants. When our pilot programs were due to commence, we contacted each participant, ensuring that they knew the start date, the time, and their location. After the first sessions, we invited the participants to join us for tea, where we set up a WhatsApp group, and that was for each one of the green spaces, so we could send out messaging group by group. And this was also an additional opportunity for us, though, for social engagement and for the group to bond. And to ensure continuous engagement, we sent out encouraging reminder messages the day before each of the sessions, and we also checked the weather apps and advised of any precautions that people needed to take, if they needed sun cream or if they needed a raincoat. And as we live in Ireland, that was both on the same day. And as you can see here, tea became a great part of our sessions, or after our sessions, and it was part of the local authorities' engagement strategy, and we gave them prior warning to maximise that attendance. This resulted in real strong and new relationships being formed, and all of our participants feeling that they were included, which was really, really important to us. Out of that, additional social activities grew autonomously through the group. For example, they set up their own walking group. Have a new slide, please. Thank you. After our pilot round 1, we held more focus groups with the participants to gain an understanding of their experiences and to see what worked well and where our approach could be improved. Any suggested improvements were put into place prior to the commencement of our second pilot round. And as you can see up here, we've got some of the participant figures for Kilkenny. I suppose one to really note of significance, and Jeanette touched on it, is the fact that we had physiotherapists both from the private and the public sector, and we had 10 physiotherapy students, which was collaboration with University of Limerick. So we're very grateful to all of those partnerships for coming together and working with us on this. The programme is still continuing. It's being rolled out in a private capacity, but affordable in Kilkenny with a large number of the same participants. So we're now going to show you, as Devin touched on earlier, a short video, which really is only a snippet of all of our participants. And it'll give you maybe an insight into the experiences of the participants and what UcanACT actually meant to them.
Und was mich sehr gefreut hat, ist, dass bei einzelnen Übungseinheiten, wo ich unsicher war, immer Expertinnen und Experten da waren, die mir zu meinen individuellen Fragen einen hilfreichen Tipp geben konnten.
Die Stimmung war sehr nett, sehr locker. Die Trainer waren sehr zugewandt. Das sind tolle, junge, engagierte Leute.
Von daher vermisse ich das oder freue mich jedes Mal auf das hier, weil es ein sehr herzliches Miteinander ist.
Ich finde, durch so ein Training kommt man sich trotzdem menschlich näher.
Ich habe gemerkt, dass durch diese Übungen einfach das Thema Bewegung mal wieder in meinem Kopf ist und ich auch zu Hause dann angefangen habe, ein paar Übungen zu machen.
Es ist ein neues Lebensgefühl. Es freut mich, dass ich jetzt mich jedes Mal noch mehr motiviere, am Ball zu bleiben, am Sport zu bleiben und noch mehr mache.
Sono una paziente oncologica e sono stata operata 3 volte di tumore. Mi sono trovata bene perché eravamo seguiti anche individualmente, con un'attenzione e una delicatezza estremi. La maggior parte delle volte siamo usciti, abbiamo fatto ginnastica nel parco, all'aperto. Farlo al chiuso in palestra, sì, è utile, eccetera, ma farlo all'aperto ti aiuta anche psicologicamente, insomma ti dà quel qualcosa in più di cui abbiamo anche bisogno per trovare un po' di felicità, di allegria. La mia età è avanzata perché a luglio ne compio 89. A maggior ragione fare del movimento, che cerco di far sempre, è più che mai utile. Tutto è andato molto bene, nulla da criticare. Io auspico che questo tipo di attività si riproponga perché è fatta veramente bene, soprattutto per persone fragili che hanno bisogno un po' anche di essere seguite, di essere aiutate. Grazie.
At the age of 77, I was diagnosed with prostate cancer, and post-treatment, I was advised to take part in an exercise program. I was told about the UcanACT program, which was set outdoors as opposed to the indoors. I've always been a somewhat reluctant participant in exercise programs, and I could hardly see myself going through a workout in a public space. But I did join, and I found that this outdoor experience has added a new and important dimension to maintaining my health. Being outdoors brings us into much closer contact with nature, and I have found that I'm more eager to join the twice-weekly sessions. I feel invigorated after the exercises, and my general level of energy has dramatically improved.
So thank you again to our pilot territories, to Janet, Catherine, Fran, Michael, and Devin. You know, the stakeholders from our consortium who worked on the ground know best how difficult it is to get people together on time and in certain places. So well done on that. We really appreciate it. And again, we will do a little bit of a shuffle. So before we move on to the more research-based version, well, not version, the research-based section, thank you, section of the panel for the UcanACT project, you know, I don't want to leave out the other members of the consortium because there is more of us. So we have Rita Stani, thank you, of the University of Bologna, whose team was responsible for the UcanACT app that was also available to the project participants. But we also have a team from the ONCE University School of Physiotherapy, and I came well prepared with thanking João Miguel Mota de Sousa. I can't see him, but he's here, very good. To Irene Rodriguez Antonegui as well, Guiomar Martin San and Susana Sangil and Susana Garcia Juez, who is also here. So, you know, there are more brains behind all of this than you can see here at the table as well. So thank you so much for making it here. And here we have, again, the ONCE School of Physiotherapy representative, Luis Mendoza Hernandez Sanauja. Yeah? Okay, good. And also another challenge, we have the representatives of the University of Sevilla. So we had 3 different universities working within that project. We have Carmen Suarez Serrano, and also Esther Medrano Sanchez as well, yes. So we will start with Luis, and we will take it from there.
Thank you, Emilia. For me, it's a pleasure to be here with all of you. And now I'm going to talk about the evaluation methodology and main findings of the UcanACT project intervention. This work was developed by the ONCE University School of Physiotherapy in Madrid, Spain. Next slide, please. Regarding the evaluation methodology, the UcanACT project applied a comprehensive evaluation strategy, using both quantitative and qualitative evaluation to assess the impact of its intervention. Next slide, please. Regarding the results, the UcanACT project gathers data from 212 participants, of whom 47 completed both interventions. The data from the first pilot run was used to improve the second one. That's why now I'm going to present the results for the second pilot run. In the second pilot round, 146 participants took part, with an average age of approximately 66 years old. A 39% had a previous history of cancer, being breast cancer the most common one. A 99.2% reported that they had achieved the goals they had before the intervention, being the first one, increased fitness level, the most common one, with an 82.9%. Next slide, please. In terms of health outcomes, they were evaluated through validated questionnaires via Lyme survey. The first variable we have here is quality of life. In the first table, we can see that all the sample improved significantly. If we go especially to cancer patients, in the table on the right, we can see that they improved significantly in the domains of role, emotional, cognitive, and social functioning, and fatigue. And if we talk only about non-cancer patients, they improved importantly in the domains of pain and on their current health status on a scale from 0 to 100. Next slide, please. In terms of physical activity levels, all the sample improved significantly, especially non-cancer participants and Munich and Bologna participants. There was also, the previous one, please. There was also a relevant decrease in the levels of fatigue in all the sample, especially in cancer patients and in Munich participants. Regarding the UcanACT app, the usability and engagement scores were moderate. The results indicate that the app was generally functional and acceptable to users. Importantly, physiotherapists tended to report higher scores, possibly reflecting their active role in managing and facilitating the sessions via the app. Now, I'm going to talk about the qualitative results. The data was collected through focus groups interviews and questionnaires, and there were 3 key groups: participants, professionals, and communication managers. Now, I'm going to talk about the first group, participants. 43 of them were interviewed in 6 focus groups across the 3 territories. 1 group of 5 participants in Munich, 3 groups of 15 participants in Bologna, and 2 groups of 23 participants in Kilkenny. They told that physiotherapists were key motivators in their journey. Their professionalism, empathy, and ability to adapt to personal needs were highly valued. They reported a significant improvement in emotional well-being, self-esteem, and motivation to stay active. They also felt more confident, socially connected, and physically capable. Furthermore, the group setting was repeatedly praised for fostering motivation, mutual support, and belonging. Participants talked about how physiotherapists encourage them long-lasting habits. And finally, they found the app appealing and motivating with good exercise examples. Regarding professionals, physiotherapists described the experience as professionally enriching and emotionally meaningful. They told that intervention had a meaningful impact in participants, and that the practical intervention methodology permitted tailoring sessions to each participant easily. Regarding the app, they felt better prepared and more confident in this second pilot round. There was a strong interdisciplinary collaboration, but physiotherapists remained the main drivers of day-to-day impact, playing a dual role as health educators and emotional support providers. And finally, let's go to the final group, communication managers, where they reported the intervention's positive social impact. They also reported notable improvements in coordination and outreach in this second pilot round, and that intervention was seen as replicable and transferable, with potential for wider European application. And now, to sum up, let's have our 5 main findings. 1, the UcanACT project intervention had a significant improvement in quality of life and physical activity levels in all the participants. 2, the UcanACT project intervention had a significant decrease in fatigue in all the participants. 3, the qualitative results highlighted a strong emotional, motivational, and relational impact of the program. 4, stakeholder engagement is key in establishing and delivering this type of program. And 5, the role of physiotherapists is a key contributor to the project's success. Thank you so much. And now, I give the floor to Carmen Suarez. Carmen, please.
Thank you very much, Luis. Good morning or good afternoon to all of you. We are pleased and thankful for having this great opportunity to present the report on economic value and cost effectiveness of physical activity cancer preventive measures. This report was performed by the team of University of Seville in Spain. In the previous slide, please. Thank you. You can see the order that we are going to follow in this presentation. That is the same one that we followed in the whole report. Next slide. Thank you. It's known, and it's been mentioning this morning during this event, how scientific evidence support that effectiveness of exercise and physical activity in prevention and treatment of various types of cancer, as well as in improving patient survival and quality of life. However, although there are indications that exercise intervention may be cost effective, the evidence remains limited, and further research is needed to determine the cost benefit of this intervention across different types of cancer. For this report, there are two important or two key terms that need to be explained. One is cost effectiveness, that assess the cost of an intervention in relation to its clinical effectiveness, whereas cost utility incorporates quality adjusted life years, which is the number of years gained. The purpose of this report was to systematically review the current evidence on the cost effectiveness of exercise therapy in cancer population. The following, thank you, these slides show the methodology where a systematic review was carried out following the PRISMAS guidelines. Several search strategies were designed for each database. Also, and according to PICO's methodology, the eligibility criteria were established, being randomized control trial in adults with a diagnosis of any type of cancer in treatment or survivors, randomized clinical trial, control trial in any type of physical exercise intervention applies as single therapy, randomized control trial where any intervention other than exercise or no intervention as comparator, and randomized control trial with cost or incremental cost effectiveness ratio as economic evaluation outcomes included. After the search, two independent reviewers performed the study selection based on eligibility criteria, and also extracted the data from each study independently, organizing this data according to the characteristics of participants, interventions, and main economic evaluation outcomes. The results will be presented by my colleagues, Esther Medrano.
Thank you. Very good morning. So here are the results of this final report. Finally, 10 clinical trials were included in this review, although two of them were part of the same trials. So they were considered as a single study in the clinical synthesis, but we considered them separately in the economic synthesis as they focused on different time horizons. Although this review is centered, next slide, please. Although this review is centered in the economic impact of exercise therapy for cancer, it also presents a synthesis of the clinical trials of these outcomes that you can see on the screen, such as quality of life, fatigue, or lymphedema, among others. And the key points, next slide, please, were that the majority of the studies reported improvements in patients' quality of life, and higher intensity exercise was associated with reduced levels of physical fatigue. And post-operative pain intensity showed improvements at 12 months in the intervention groups compared to usual care. But however, there wasn't enough evidence to support the effectiveness of exercise on neuropathic pain, despite some beneficial and clinically meaningful outcomes had been reported. And there wasn't enough evidence about improvement of upper limb function, lymphedema, or other outcomes. So in terms of costs and regarding the economic analysis description, unfortunately, we could only conclude that in general, results on whether exercise is more costly or saves money are still inconsistent. Some studies suggested that exercise may be less costly or have similar costs to usual care. But in contrast, others found higher costs in breast cancer with no clear benefit to quality of life. Concerning the analysis of incremental cost effectiveness ratios, these are the results. Although due to the heterogeneity of the studies, comparisons were really difficult. Some studies reported results in favor of exercise interventions, stating that exercise was less costly and more effective for patients with colorectal cancer and breast cancer with or without metastases. And other 4 studies reported results which did not clearly support the effectiveness of exercise as it was associated with higher costs without a clear benefit on quality of life. So our conclusions were that overall, and although the evidence is still inconclusive, there is a trend to believe that exercise for cancer may be cost-effective and even dominant in certain populations or contexts. And finally, we'd like to emphasize the important impact of physical activity on cancer prevention and its treatment side effects from the clinical point of view, and its contribution not only to improve those symptoms, but to improve patients' quality of life. So, of course, further research is still needed, and we are here and we have a great opportunity to keep on working and doing research in this field. Thank you very much.
Thank you, Will. I think it might be my presentation not saved properly, but that's okay. So we are basically coming to the end of the UcanACT project, and the conclusion is that we created a project that was successful on different levels. It really impacted 3 stakeholders. So the main group was the participants. The program proved that it benefited their health and mental well-being and emotional well-being as well. For the physiotherapists involved, it proved that it's possible for them to reach the community outside of their offices and bring it really, bring the community-based care. And in terms of the community stakeholders, such as local authorities, the project demonstrated the effectiveness of collaborative approaches in supporting the program's implementation. So in conclusion, our project really delivered what it promised, which was physical activity sessions led by physiotherapists to the group of people who are aged 50 and over, and all of it in parks that are close to them. And really, this project is ready for a wider rollout. So we are very happy to give out any tips. You can, use our resources that the project created, and I can unofficially say that we have some interest from the Czech Ministry of Health in terms of this program. So this, even before the conclusion of the whole project, there is hope that maybe other territories will continue it. Of course, each territory requires own tailoring depending on the local needs and its population as well. So we have 3 languages here, but it all can be translated into local languages as well. So I'm a bit rushing because we are short on time, as it always is with those events. So before we really finish, and Esther Mary Darcy, who is our chairwoman of the Europe Regional Forum, before Esther Mary provides us with final remarks, do we have any questions from the audience? Yes.
Yay. Well, I wanted to break the ice. Well, first of all, thank you so much for the presentations. They were great. And actually, now that I have Kathleen with me, next to me, I would like to actually pose you a question. So we've seen that projects like this are successful and create a sense of belonging and actually improve the physical activity and health of the population. So from the high level, how can European policymakers advocate for programs such as UcanACT in this case in their own countries?
Thanks very much. Again, just to say thanks to everybody that's been involved in this work. I think there's a number of things that we can do. First of all, raising awareness, because to be honest, when I first saw, obviously in preparation for today, and we had meetings, that 40% of cancers are preventable, I think that's actually quite shocking. And I think a lot of general people just don't know that. So part of it, I think, is about raising awareness with that link. And it obviously makes a lot of sense when you say, if you're, more physical activity, you're healthier. Yes, it makes sense. But sometimes actually translating that message, it does get lost. And I know one of the presentations mentioned, particularly people from a particular socioeconomic background, there's issues around food then as well, and what is affordable, particularly as we go through cost of living issues at the moment. But I think practically, I know my colleague mentioned the intergroup. There's various intergroups, like obviously the EU has committees and has a health committee, but there's intergroups and interest groups as well. And I think that through working with like-minded individuals who want to promote projects like this, who want to raise awareness, getting it discussed in the committee rooms, getting it on the agenda, having it potentially discussed at plenary level, whether that's Strasbourg or the plenaries here in Brussels, and then looking at the big question, which is always, how are these projects going to be funded? And I know national governments have a big role to play through their departments of health, but I also think that, we need to be certainly taking it a lot more seriously from an EU level if there's prevention programs in place. As well, I would argue, for people who've come out through cancer survivors, because I think one of the things that was mentioned by people who've gone through the program is the sense of having other people that were in similar situations outside of maybe our traditional support group. So I think that, just to kind of sum it up, raising awareness is one thing. Second of all, to see how we can kind of get this clearly on the agenda. And I mean, like, taken seriously on the agenda, not just, kind of ticking a box. And then if there is any potential funding, and I'm unsure about that to be honest, but if there was, to see how we could tap into that.
It's great to hear. Thank you so much, MEP Kathleen Funchion, and I know that you're also in a hurry to another event, so thank you so much. We're not going to be keeping you any longer, but it's also this important aspect that MEP Kathleen Funchion mentioned, and it's always the budget. It's always the budget, and it's always the funding that is or is not available for health initiatives. Are there any questions from the audience? Yes. If you could also introduce yourself and say which organization you're from.
Good morning, Juliana. I work for the European Cancer Organization. And first of all, thank you so much for this amazing event, both the first panel and now more the practical side of things. It's been really, really interesting. And maybe it's not a question, it's more a reflection or a question to all of us. And when I was coming to this event, I was thinking about the recent published article that Alba talked, that basically, in very simple terms, they divided during 3 years people that had colon cancer in a group that would do physical exercise, physical activity, and another group that would receive health promotion materials. And when I was reading the results, I was really excited about it because it's really like evidence that proves that like the survival in the group that was doing a physical activity is way higher. And I was wondering myself while I was reading the article, how it would be if it was about a medicine and not about a change of life habits. And I want to also bring this to all of us and like to all of us that have a practical side of things with the citizens work direct, but also us that work more in the advocacy sides of things. How can we make this attractive to policymakers, to people that really have the power to change, that like physical exercise can be fun. People can have, like, how can we show that it's not like you don't need to pay anything. You do this and your survival rate will increase after a cancer diagnosis. Of course, it's very important to talk about cancer prevention, but also like in practical terms for people that had cancer. And so it's not a question, it's more a reflection to all of us to how can we make this clear that there's evidence. So it's on our ends. Thank you.
Thank you so much. And I guess while still there is this point that Esther mentioned that more research is actually needed in terms of proving that physical activity impacts cancer prevention and also, cancer in general in terms of secondary and tertiary prevention. But also, like, this is this holy grail question: how can we make it attractive to policymakers? If someone comes up with an idea, please let us know. But thank you so much for your comment as well. Are there any questions to any of our panelists who have been speaking today? Anything specific? We don't often have a chance to ask these questions in person. So if there is anyone with something really, something that is really surprising to you to hear, for example, or about any of the statistics or any evidence that we have seen so far, you have the floor. Let us know. Nothing. Okay. It's okay if we don't have questions as well. And there is one more thing that I actually forgot to mention, even though I have it in my notes. As the Europe region, so the organization that I work for is the coordinator of the project. I took this project over from the previous project manager who is here with us. So Eleanor Leroche has started working on this project originally. So this is also like her fruit. So she put a lot of work and effort for the first half of the project, really. So thank you so much, Eleanor, for making time and being here with us as well. And if we don't have any questions, we can conclude with Esther Mary's wisdom.
I don't know about wisdom, but thank you, Emilia. And thank you to Kathleen Funchion and Georgia as well for hosting this. We're very grateful. Kathleen in absentia. I'm very proud that the European region of World Physiotherapy was the coordinator and the lead for this project. The region has been very much orientated towards enhancing the awareness of the role of physiotherapy in Europe. And in doing that, we chose the area of cancer, which was an area in which we were not well known for. We as physiotherapists know our role, and indeed the extensive role, not just physical activity, but the extensive role that we have in working with people with cancer. But we really thought that people with cancer and people throughout Europe and indeed the European Parliament were not aware of that role. So this project clearly helped to demonstrate that role. The evidence is irrefutable in terms of the role of physical activity in cancer prevention, both primary, secondary, and tertiary, as you heard today from our colleagues. But I think that the fact that it was also physiotherapy-led is crucial, because not only are physiotherapists the experts in movement, in specific exercise, targeted exercise programs, but also they have been trained in health promotion. And sometimes the term is thrown out, but really, in order to be health promotion, it's got to be empowering and it's got to be participatory. And this is essentially what this project was about. So the combination of the physiotherapist's expertise in the area of movement and physical activity, combined with that training that they have and capacity to empower the participants to participate. There's such a chasm between education, knowing something, and behavior change, doing something. So that is where health promotion really comes in, and that combination that the physiotherapists who are trained in both and have that expertise makes a huge difference. I think the other successes of this project were due to the fact that it was in the true sense international, in that we had 5 countries involved, and also that it was intersectoral. And if we are to address the inequalities that Caroline so frighteningly but eloquently showed from the OECD, we need to get out to the communities. We need to get out to the people rather than expecting the people to come to us. And the fact that not only was this in the communities, but that it was in the green spaces as well, which has a huge environmental aspect to it, which is another area close to my heart. But I think that the cooperation with county councils such as Kilkenny, and I must pay tribute to my colleague, who was in my health promotion class, Fiona Donovan, who said Kilkenny is the county council that you need to sort of target. So thank you to Fiona for that. And I think if we look as well at the countries involved, I think in Italy, and I know that Michele is very proud of this, they had the most sessions with 65, so they far exceeded the sessions that were needed. I think that you look at Germany and you look at that lovely video and what we saw this morning, the aspect that people talked about was about the closeness, the community, not wanting to get involved, but being empowered to get involved, and certainly not regretting, and very glad that they did. They also mentioned the fact that the expertise was important, and that their specific questions could be addressed. And then in Ireland, the students were also involved, and I think that's important. They're obviously the future of our profession. We need to make sure that they know what's going on, that they are involved in community projects. And also, I think that Kilkenny was shortlisted for an award with their local authorities. So that's another great way of getting the message out. We did have a presentation at World Physiotherapy, which was wonderful to be on the world stage. And I know that Fran presented on behalf of the consortium, but really we need to get it out to non-physiotherapists. We need to get it out to the policymakers to really impact. And I was very struck by what, I made a note of it, about what Alva said about political inaction perpetuates inequality. And I really think we all need to drive and to get to our MEPs, to the other MEPs, other than the 2 who are here today, but to all of us in all our various countries to actually promote this, because we really, the action can come from the bottom, as we've shown through this project, but it also needs to come from the top. So I think we've got to keep doing that. I think one more thing I'd like to say is just in terms of health promotion, we have this wonderful Ottawa Charter from way back in 1976, which still stands today. But when it was evaluated 10 years later by Ilona Pickbush, who I'm sure many of you follow, she said that the most important aspect of this strategy, of this Ottawa Charter, was settings. Okay. And I think that in using communities, we are using settings. It's where you live, love, work, laugh, and play. And the more we can impact the physical activity through the people in terms of prevention, the more impactful we will be, and the more those settings will come together, and eventually we will have a healthier population. So I just would like to conclude. There's so much to say and so much I'd like to say, but I know we have to keep to time. I would like to thank the 8 groups, to thank the 5 countries. Most of all, I would like to thank those participants who did come forward, who did participate, and great to know that they're going to continue, and hopefully that they will spread the word. And I would also like to mention Eleonora Luoch. I know you already have, but Eleonora was the start of the project. It's great to have her here today. And I would like to thank, and I know that you tried, Darren, to thank Emilia, but she almost pushed you away. But I think we owe a great debt of thanks to Emilia for coordinating that, and for, keeping everyone in check including myself. So thank you, Emilia.